Hi, I'm Mike Duggan. I've been teaching restorative dentistry for over 32 years now and to over 6,000 dentists. This video shows how I do it. Real-time, mannequin-based, hands-on, point of view, and patient real. If you are a pre-dental student, an aspiring teacher, an international dentist, join me at Duggan Oral Design, DugganOralDesign.com. So I have a Typodont that is got a couple of preps I've left on it, but for what we're doing for today, I'm just going to make sure I'm going to mark. So I use the articulating paper and I bring it around, I follow around the arch like this. And I use a 7404 burr, which is what I was using this morning. And then what I'm going to do is so I'm going to look at the surface and I'm going to try to grind off. I'm going to just lightly touch this area here and a little bit over here. Now I have some contacts in these areas. Any contacts that look like donuts with a lighter center. And so I got some big contacts over here. So in order to get more contacts, you have to grind off all that you have. When you grind off all the contacts that are keeping the arches apart, then you'll get the arches coming closer together. And you're grinding just the functional cusps. Don't grind the non-functional cusps. The functional cusps are easy to keep the contours nice because they're nice and rounded. So I'm rolling the burr over these cusps to try to keep the shape while I'm just polishing off the contacts. Okay, so I don't have any A contacts out here yet. I have an A contact on this side. So the heaviest contacts seem to be on this second molar over here. So I'm getting a contact here on the second molar. I'm getting a good contact here on the second premolar. So that stabilizes the arch in the area of the first molar. So I'm getting a contact here on this side. I don't quite have a contact here, but then again, these two teeth I probably would have had contacts on to stabilize this side of the arch. I'm going to adjust it one more time. Then I'll go ahead and do the occlusal reduction. Yeah, it'd be nice to get A contacts there, but we can still reduce that A plane and get the clearance that we want on 19. So these contacts I'll reduce on the upper arch. So again, when you grind off all the contacts, the arch closes and you get more contacts. And then you grind them off, arch closes, you get more contacts. So that's the way we approach this. Ideally, we'd have nice, stable vertical stops on both sides of the first molars and on the anterior teeth so the Typodont can't rock anterior posteriorly. At this point, that's usable. All right, and unfortunately, I had forgotten, since I'm doing 19, I left this tooth in as the prep that we did yesterday, and I probably shouldn't have because we want to get an A clearance right in this area too. But for right now, I'm just going to demonstrate the basic anatomy that we want there and how it looks when we look up this way. All right. So I'm going to use the 837 diamond burr, which you're familiar with from yesterday. There we go. And we'll just take our time. Okay. So I'm going to start by doing the A plane, and I'm going to look first of all to see where the grooves are relative to the opposing cusp ridges. They're actually pretty close. The grooves and cusp ridges line up pretty well at this point, so let's just make the first guess and make a groove about here and another groove about right here. And then let's look to see if we put them in the right place. Okay, so I'm going to shift each one a little bit mesially. And so now we got about the right location for those grooves. I have the burr angled at a vertical angle that we'll see in a minute. It's going to match the opposing tooth. Now I'm going to cut between these two grooves, but keep the grooves well defined. From this groove to the embrasure, from this groove to the embrasure all the way over here. We're going to make sure we have the grooves well defined every step of the way. So we're going to keep those grooves exactly where we want them, which is where the opposing cusps are. Okay, so we're getting some clearance all the way along there now. Obviously not enough, because this burr has to fit through there. So we could have at least 1.3 or 4 millimeters clearance. So let's do some more reduction, but when I do, I'm going to maintain the position of those grooves and maintain the vertical angle. Okay, so now we're getting some more clearance. Still need a lot more. But again, we're concentrating on making nice ridges. Or sorry, nice grooves. So this facial groove, I'm going to move it back to the mesial a little bit more. So notice how many times I check. And notice every time I check, it's in the mirror, looking up the plane. And I can see the vertical angle of this plane compared to the opposing tooth, and the vertical angle is matching the opposing tooth pretty well. And now we're starting to get some clearance. Obviously we have plenty over here, but I don't quite have the 1.2 there yet. Here it's about 1.2. Here it's a little bit less. Here it's a little bit less. So let's do a little more. But again, we want it to look like it's been done very carefully with the opposing tooth very much in mind. Okay, so now we're starting to see the relationship between our prep and the opposing tooth. That's what we're looking for, okay? All right, now when we do the B plane, we can see through here, we can sort of see already that we don't have very much clearance there yet because we haven't reduced it yet, but it doesn't have, you know, it's pretty close to being an occlusion. So here's the B plane. So the vertical angle we can take from the adjacent tooth like this. We're going to make a ridge in this position in this direction. So I'm going to come down from that area and I'm going to reduce right down to the top of the marginal ridge. I'm going to get really close to the adjacent tooth here, and then come down to the other side of that ridge this way, and then bring the end of the burr out the facial groove when I get to the central groove, to the central fossa. So down here, and out the groove. Then we can look to see how we're doing as far as clearance is concerned. We're getting some clearance there. We'll measure that in a minute, but let's first of all finish the other side of the B plane. Point the burr tangent to the corner of the adjacent tooth toward the center. So I'm looking pretty much down the axis, sitting behind the patient, so I can see the directions. And I can take the vertical angle from the adjacent tooth, as we did before. Point the burr in the right direction, have the right vertical angle. Then I'm going to come out the facial groove. And then down here to the distal facial groove. And then down the distal cusp this way. So plane 1, plane 2, plane 3. with the burr always pointing in the same direction. Now, we can check the clearance that we have right now. So the ball burnisher should fit easily over here. And it does. I can slide it right past the adjacent tooth into this area. And when I put it on top of the ridge, I can feel there's a fair amount of extra room. That's fine. If I go this direction, I'll find out this ball burnisher doesn't fit through there at all right now. So I need to do some more reduction on the distal buckle. But again, always do it with the burr pointing in the right direction. Keep the end of the burr in the middle of the tooth, so it's creating the central groove in about the right place. Plane 1 out the facial groove, plane 2 down to the distal facial groove, plane 3 down the distal cusp. Okay, so I can sort of see that I'm starting to get some clearance there now. So I'll take the ball burnisher and slide it through, see if it fits all the way through there. Okay, up at toward the cusp, it fits through. I need to get a little bit more clearance there, but it's fitting through anyway. And then down toward the central groove, doesn't quite fit. So let's do a little more. Okay, that may very well work now. But again, make sure you check each part while you're doing it. So now it fits over that ridge pretty well. But check over each part. Make sure you're happy with your functional cusp, the A plane and the B plane of reduction. The cusp right here is fitting into the central groove of the opposing tooth pretty nicely. Same thing with this one over here. Now let's do the C plane. So the distal lingual. Okay, so where should I put this ridge? I might have to move it around a lot. In this particular Typodont, if I sort of peek there, I think I'll start with it just about where it is now. And then we'll see. So I'm going to come down this way and bring the end of the burr out the lingual groove. Down from the ridge, out the groove, then down this direction. So I've got a plane over here, out the lingual groove, and then another plane over here, down toward the adjacent tooth. Now, I can't really see by direct vision if that is fitting into the opposing groove here or not. So I have to check that with either bite wax or some indirect method. Now, you notice I've already reduced a lot around the mesiolingual cusp. So now I'm going to just get rid of all this excess here. That'll probably give me close to 1 millimeter of reduction. And I'm going to have this ridge and this ridge come together in a V shape. So I'll point the burr in this direction, get the vertical angle, come down to the marginal ridge, and then come down this way. All the way to the central groove, and then out the lingual groove. Down to the marginal ridge, down here out the groove. Down here out the groove. Down here to the marginal ridge. Down here to the marginal ridge, down here out the facial groove, and then over here, out the facial groove to the distal facial groove, and then to down the distal cusp. So those are the basics. Now, we can see the clearances on the A plane and the B plane pretty nicely. The lingual cusps are a little bit harder to tell, so we're going to use a bite registration material. So I have this stuff over here, and I had some extra mixing tips, but they have evaporated. I think I know where my bag is. Okay. I have a bag of smaller mixing tips. Just have to find them pretty soon. Anyway, we'll just use a bigger tip for right now. Okay, so this puts on a little bit more material than we need, but we're going to blow off the dust. We're going to mix it up and get it right over the occlusal surface. Unfortunately, we lose a lot of material in the mixing tip. Then we're going to close it down. Make sure that you check that the adjacent teeth are in the occlusal scheme that you did when you equilibrated the Typodont. And if they are, then what you're going to get now is something that's accurate and meaningful. This stuff takes about a minute to set, so not too long. Okay, almost there. And again, we're going to evaluate it by looking at it with some light coming from the other side, so we can get an idea how thick things are. Now, sometimes what I do is I take a pencil and make a mark on that ridge. So the distal lingual ridge is right here. So what I want to see is the thickness of the impression material the same here and here? If it is, if the color is the same here as it is here, then that means that this ridge is in exactly the right location. And then we sort of get calibrated. If this thickness is a millimeter, it'll have, you know, a certain color associated with it. So let's go take a look. Okay, so you can see now the color of this material on the distal side is lighter than it is on the mesial side. And it's lighter here toward the central groove. So I'm going to reduce more on the distal. That'll shift the ridge a little bit mesially, and then I'm going to reduce a little bit more toward the central groove here by having the burr a little bit more vertical in this area. And the other areas we can measure directly, so no surprises there. All right, so let me make a little change. So I'm going to, as I said, I'm going to reduce more on the distal side. So that'll shift the ridge a little bit more mesially. This area over here is going to go away when we do the axial reduction, so that's not a big thing. I'm going to make the burr a little more vertical and reduce a little bit more on the mesial side toward the central groove here. So that'll probably be about right. Now, when you're learning how to do these occlusal reductions, and you want to check yourself that you're measuring the clearances indirectly, accurately. Again, you can't do this during the exam, but when you're learning how to do this, you could take the Typodont out and then look from the lingual and even take a ball burnisher and put it through the patient's throat and try to measure the clearance on both sides here. So I'm guessing that it's about 0.9 in each of those areas. So I probably need to get a little bit darker color on the impression material than I got, but it's just about fitting through, but just a little bit less than it should be. So I'd probably reduce just another 1/10 of a millimeter on both sides there. So we want to get the impression material, you know, reasonably dark with a really bright light behind it. so that we'll have a good idea where we are. All right, so occlusal reduction of the upper molar, we're going to do number 3. And so I'm going to take the usual 837 burr. And of course we want to make ridges that fit the opposing grooves. So this one I'm going to shift a little bit distally. But make sure you reduce all the way down to the marginal ridge, because that's where we start when we do the B-plane. And again, for a full crown, you don't have to worry as much about the vertical angle, but we want to make sure we have the end of the burr reducing the central groove. And then bring the end of the burr out the facial groove, just like we've done before. Compare it to the opposing tooth. So you see I'm getting close to a 0.5 millimeter clearance there, maybe a little bit more. Okay, so almost there. But again, for a full crown, get a full millimeter. Don't hesitate. We might compromise a little bit on an aesthetic crown where we're not going to be bringing gold over the facial cusp. All the way down to the marginal ridge on the distal side as well. And we'll check the clearance. So it's easy enough to check the clearance on the A-plane. See over here we need to get a lot more clearance there. I would make the ridge a little more vertical. Make the central groove a little deeper. And I can get more clearance where the opposing cusp is. Okay, that's a little more clearance, but we'll get a little more still. So again, the position, the vertical angle, those are all things that we work with and we experiment around until we have just what we want. Okay, so that'll be a good start for the A-plane. Now the B-plane, as I said, now we're going to use direct vision. So I'm looking along the arch this way. There's a vertical angulation for the B-plane. So I start on the marginal ridge, which I already reduced, and then cut straight through. Just push it from the marginal ridge. Keep reducing all the way across, a little bit at a time. I'm reducing about 1 millimeter at a time here. You can see how much I'm reducing as I do it. And just keep doing that until you go all the way through the oblique ridge. When you get through the oblique ridge, then you run out of tooth and you don't have to reduce anymore. Now we're going to make the distal pit. Now I'm back to using the mirror again. So I'm going to use the distal. I'm going to start with the distal pit and come up this way. Notice I'm putting the pit in the distal side of the tooth, and I'm bringing the groove up diagonally. I do this side of this groove, reducing the distal lingual cusp. I flip it over to do the other side. That gives me the groove, and it's a very well-defined groove, and it's going just the right direction. Then I'm going to point the burr this way when I do the C-plane. In the mirror, I can easily see the difference between pointing the burr this way and this way. So use the mirror and look this way so you see that you're pointing the burr in the right direction. Then keep it pointing that same direction all the way around here, and we'll be fine. Just make sure you keep the burr pointing the same direction everywhere. You can't miss. Make a nice groove there. You can make some modifications, of course, once we do the indirect method for checking the clearance. Just finish it around the corner like this. That's all we have to do. But the burr pointing in the right direction is the key to the C-plane here. Okay. Okay, so there's the basic anatomy. We know we have the clearance we need on the A plane. It's kind of hard to see on the B and the C plane, so let's use indirect methods for that. Could somebody bring me one of the guns and the mixing tip? Thank you, ma'am. Okay. Okay, so we'll go ahead and inject a little impression material here. Again, whether using wax or any kind of material like this, you're going to be looking to make sure that the occlusion on the adjacent teeth is the same, even after you put the registration material in. Okay, so then we're going to hold it for a little bit. Okay, has everybody used this technique for checking clearance so far? Okay. So that's a good approach. Doesn't take too long to set, does it? Okay, so there's the basic prep. Let's turn my headlight off. So let's see what it looks like with the light on the other side. Okay. So one of the things is, when you're looking at it like this, we want to turn it so that we're looking perpendicular to the B plane right here. So we're really looking at the thickness. If we look this way, we're seeing through it diagonally, and it's going to mislead us. So I think I need to do some more. We need 1.3 to 1.5. I think I'm going to need more than that over here, and more on both sides of this groove, and a little bit more on the mesial side over there. Okay, this we can measure directly, so we know what that is. Okay, so